The US funding freeze has thrown the Kenya health sector into a spin, with the source of funds for key programs amounting to nearly 25 billion shillings now at risk. The Ministry of Health says that the freeze has exposed critical services like HIV management, vaccine programs, nutrition and blood donations to disruptions, threatening the lives of thousands of Kenyans. The government is now forced to seek alternative donors to ensure continuity. Brenda Wanga details the government's plans to retain a section of healthcare workforce previously funded by the USA government.
The extent of the impact left in the health sector in Kenya following the freeze of funding by the USA government has today been laid bare by the Ministry of Health.
As we said, for commodities, 24.9 is by US government, 79.8 to Kenya, and 79.8 health commodity need. That is 24.9 out of the 79.8 commodity need.
The recent stoppage of work order by the United States government has exposed our over-reliance on external donor funding for key health programs.
Our objective as government is to make sure that no decision that is made by our development partners affects the quality of healthcare we provide to the people of Kenya. So we are making all necessary contingency decisions and arrangements to ensure there will be no disruption.
Kenya has looked to the USA to run key health projects over the years. Those funds are now no longer a guarantee. Aside from the key HIV and AIDS, malaria and TB interventions, the US funds have also been critical in the provision of human resources for health to the tune of 5.8 billion shillings per year, provision of oxygen, laboratory, cervical cancer and COVID-19 issues for 3.7 billion shillings, the distribution of commodities at 2.2 billion shillings, data systems 139 million shillings, blood and blood products 2.7 billion shillings, family planning services at 598 million shillings, nutrition services at 2.88 billion shillings. At the same time, the government will need to immediately disburse some 2 billion shillings in addition to 2.5 billion shillings for Gavi vaccines to ensure compliance.
Actually coming to 30.922 billion that we require for seamless transition.
About 11,000 healthcare workers who are financed by the US government across the country have been affected, threatening service continuity in both public and private facilities.
The funding freeze is also set to further endanger the lives of Kenyans at risk of infection from HIV/AIDS, as well as an increase in the TB mortality rates in the country.
And we are at risk of having 58,495 new infections by 2030 if donor funding is reduced. For TB, we are likely to have 23,500 TB annual mortalities, among them being 20,000 people living with HIV.
The government's acknowledgement of the adverse impact of the freeze comes as the impact of the same continues to manifest, especially in the non-governmental health sector, with over 150 clinics already shut down and hundreds of healthcare workers rendered jobless. The government, however, says it is also exploring other funding avenues, including engaging other donors as well as allocating more funds sourced locally to ensure that health services are not adversely affected by the USA orders. Brenda Wanga, Citizen TV.